Good morning, folks. My name is Paul Herdman, and we're going to get started in a minute, letting folks get started, and we'll start in about 2 minutes. Good morning, folks. We're going to get started in just a few minutes. We're just letting folks log on. Okay, we're going to get started. I know folks are going to be logging in, and just want to cover a lot of ground today, and so I just want to get started and be respectful of your time. My name is Paul Herdman, and I run Rodel, which is a nonprofit that works on public education here in Delaware, and want to just say thanks. Thanks for the more than 1,000 folks that actually participated in this parent survey, and we have 150 plus folks on the call today. We got some great panelists. We have some parents. We have some folks that are education and health officials, and we're going to introduce those folks in a minute. In terms of the flow, it's really just 3 parts beyond these welcoming comments. I'm going to turn it to Diane Frenzel from Delaware Readiness Teams to provide some comments around the overall survey results. The full results are going to be available online in the chat. If you just go to www.rodelde.org. And then we're going to really open it up to a conversation. And Madeline Reitmeyer, who is the Senior Vice President for policy here at Rodel, is going to facilitate that conversation. And then we'll just have a couple of minutes to wrap up. Really, when we think about the objectives, it's big picture, try and provide some perspective on what's happening in this pandemic. I'll just say, as a quick aside, I'm the parent of 3 kids and have been an educator or involved in education for 30 plus years. And this has to be the craziest time that I've ever seen in terms of going into September. As an educator, I'm somebody who gets excited about September, and this is a really uncertain time, and probably the most uncertain time for us parents and educators for probably a century or so. So it's a very opportune time to have this frank conversation about kind of where we are as a state and a community. We're going to try and surface some ideas around what we need to do in regard to some of the concerns that folks are wrestling with. And we hope that this begins to inform some state policymakers around their school reopening plans. Margie Givens, who runs ASPIRA, is on the call today, and is going to be a panelist and can provide some sense of how they're handling school reopening. But we hope that this conversation helps inform that broader discussion, because there are a number of policymakers on this call as well. So if we go to the next slide, just quickly some context on who we are. Rodel, again, is an education nonprofit. We've been around for about 20 years. And we try and work to do 3 things. We work to align, catalyze, and drive large-scale change. What I mean by that is that we try and align key players locally, nationally, sometimes internationally, on what the issues are. We then try and catalyze the resources, whether that's financial or human resources or good ideas, to move an idea forward. And then we try and drive large-scale change. In this conversation, we're really just trying to align folks on kind of where we are. This is a very unusual time. In terms of ground rules, we're in the midst of trying to manage a pretty large-scale conversation today. So again, there's over 150 folks. So most folks are going to be muted, but there is a chat box. We're going to try and address your questions in real time. I think probably folks are pretty familiar with Zoom calls at this point, but it's on my screen, it's in the middle. Might be on the bottom right of your screen. But use that liberally as we're going through this, and we'll try and address your questions in real time. We're going to record this, so you'll get a chance to capture all the slides as well as the conversation and all the conversation that goes on in the chat. We have done our best to prepare, but there may very well be a glitch here and there. So in anticipation of that potentiality, please bear with us. Again, just some context on the slides. On the slides you're going to see, and Diane is going to talk through, more than 1,000 folks. This is not a scientific survey. It was started in May to June, and a lot happened between then. That really things shut down in mid-March. So this was a couple of months afterward, up until about a month ago. We're trying to address the sense of the health and safety issues. And for folks that are more interested in this, if you go to our blog, which we'll provide later, but it's just the rodelde.org/blog. There's a number of resources that relate to that, including some more opinion pieces. But we realize that this has been a crazy time, and this is following on a spring that really kind of caught folks off guard. And it not only affected K-12, but folks who are in early childcare, as well as higher education. And we know the parents want to get away from figuring out how to be an educator in a freelance sort of way, and in addition to doing their day jobs. And they also know that it's great for kids just to be socializing, but there are obviously some serious health concerns. And to do this well is going to be complicated. It's I know Margie's going to speak about. So in terms of the respondents, Neil, if you go to the next slide, this is heavily weighted towards Newcastle County, so it's not a representative sample. We have about a third of the folks that are on this, that filled out this survey that we're dealing with some sort of layoffs or furloughs of some kind. Most of the folks who responded have reliable Wi-Fi, but we know across the state, if you go back, we know that most folks have reliable Wi-Fi, but we know that there are also pockets in the state where up to 30% of folks do not. So this is again a snapshot of those who responded. And if we look at the folks that are involved in the survey, if you go to the next slide, about a third of the folks are dealing with layoffs or furloughs of some kind. We realize that half the folks are considered essential workers, again, sort of wrestling with this in very real time. Again, these slides and many more are available in much more detail, and we'll make those available to you. But at this point, I'm going to hand it over to Diane, and she's going to give you a little bit more context on what we heard in the survey. So thanks.
Hello and good morning. My name is Diane Frenzel and I am the program manager of the Delaware Readiness Teams. The Delaware Readiness Teams are a statewide initiative of volunteer-based teams that bring together families and early learning providers, schools, and communities to really help children birth to age 8 get ready for school and life. And so when this pandemic hit, the Readiness Team members have heard many stories from families sharing just all of the things that they have been going through. And we really thought that this survey was a great opportunity for that family voice to be heard and to better understand and identify some of the needs to support families during these challenging times. So next slide. First, I'm just going to share a little bit more about how the COVID-19 has impacted families, and then how parents are looking ahead. And again, as Paul pointed out, we do have the full results, and there is a link in the chat that you can use. Parents with children home in quarantine are pretty stressed out. So we've had more than 8 out of 10 parents say their stress level is somewhat or much higher than usual since the pandemic hit. I myself have 2 boys, an 8-year-old and a 10-year-old, and I have been trying to balance working and the many roles that I have as a parent and the homeschooling and the summer enrichment, and it has definitely been a challenge. Next slide. But more specifically, parents are really concerned about missing out on socialization for their children. And of course, they're trying to balance their work and family and the mental health aspect. And then another concern is, potential exposure to the COVID-19 virus. And so while most parents did worry about the socialization piece, the parents that had younger children said that they were most worried about balancing that work and family demand. So we did ask families what would happen if their childcare program wasn't open when they were called back to work. And naturally, they said that it would create a burden financially, it would impact their work-life balance, it would affect their child's development, and many might need to scramble to find a new childcare provider. And here you can see some quotes from families. We did ask this question because even before the pandemic hit, we knew that many families struggled to find affordable childcare, and providers already operated on very narrow budgets, and they're now facing even lower enrollment. And there's also additional expenses that have come, such as needing additional cleaning supplies and different safety equipment to keep up with the guidelines that have been set in place. We've also heard that the pandemic has decreased access to health services, with 72% of families saying that they, their child, or both have missed those services. And we did find from the survey that parents of students with disabilities were more than 50% more likely to report that their children missed their checkups or medical services, medication, and or some type of home visiting services during the pandemic. So while we have learned that the pandemic's caused additional stress for families and they've missed services and they have many other concerns, we choose to look ahead. And in looking ahead, we ask families what type of accommodations would actually help if when it comes to child development. And nearly everyone said that some additional resources to help their kids learn and develop would be helpful. This has been one of the primary functions of our schools. And I know personally, I will be the first to admit that I myself had to go back to the basics and relearn things like long division. I can't remember the last time that I had to use that without using a calculator. And as a parent who didn't learn the way children are being taught now, it was just another obstacle and another learning curve as a parent trying to balance many things. Next slide. So parents also said that they wanted health and safety precautions. And so with that, we know that the Public Health and the Department of Education have come out with guidance like required cleanings and temperature checks. And we do have links to all of those resources for you to check out the recommendations that are in place for both schools and early learning settings. Next slide. We've also learned that most families do not want lowered academic expectations. And lastly, parents say that they want to get more involved with their kids' education this year, which may end up being the silver lining, that parents are a little more invested because they're helping their children, teaching them one-on-one. So hopefully we do have a silver lining in this. As I mentioned that, if you go to the next slide, the full survey details are available, or you can, once again, you can email any questions that you may have or any comments that you may have about that. So that is kind of our full just survey snapshot of what we learned. And now I'm going to turn it over to Madeline Reitmeyer, who will lead the discussion for the panel.
Good morning. Thank you, Diane. And I just want to say how grateful we are to have this amazing panel. You can see here we have Lindsay, who is a special education teacher and parent, Madeline, who is a school counselor and parent, Denise Suell, who runs the Early Childhood Center at Delaware State, Margie Lopez WAITE, who is the head of school at Las Americas ASPIRA Charter School, and Sarah Shank from ChristinaCare and clinical primary care and transformation, and also a parent. So I'm going to ask all of them to turn on their video, and we will start by asking them to each share their perspective and help paint the picture from your perspective of what this has been like, what challenges you're facing, what are you kind of thinking about as we look towards the fall. Lindsay?
Good morning. I'm Lindsay HUDSON-HUBBS. I am first and foremost a parent of twin 4-year-olds who will be rising to kindergarten in the fall, and a 7-year-old who will be going into 2nd grade. I'm also a special education teacher with Indian River School District. Just to kind of paint a picture of the last months of school, 2 of my children were in childcare prior to March 13th. So I kind of kept their pre-K going on my own, not having, you know, my own curriculum of pre-K. I'm not a pre-K teacher. And my first grader at the time was still finishing 1st grade. So I was a mom teacher to her and a teacher to my own students. I offered Zooms several times a week to my students, which was tough because I have my own 3 here who need. And so it kind of looked like get up and get them breakfast, get on my Zoom, get off of my Zoom and get them lunch, get on another Zoom if I offered an afternoon one, help in between my 1st grader with her work, play in between home responsibilities, and then at night when everyone went to bed around 8:30, I would sit down and do my planning, which usually lasted until midnight, 1 o'clock in the morning for my own students in classroom. Thankfully, I have parents who are close by and were able to provide help during my Zooms. Sometimes they couldn't, so sometimes I would have to leave my class Zoom to go deal with a kid issue in my own children, or you know, they would be banging on the wall because they needed something or somebody didn't get along and had an argument. So that was basically our last months of school.
Madeline, do you want to go next?
Sure. So my name's Madeline Reitmeyer, and I'm a school counselor in Red Clay Consolidated School District. And then I have 3 children, a rising 6th grader, a rising 4th grader, and a rising kindergartner. So this past year, my youngest, she had been in daycare, and the same thing when the school shut, obviously with the governor's orders, her pre-K shut down as well. So for me, a lot of this pandemic has looked very similar to Lindsay. As a school counselor, it was a little bit different in the way my time was happening, but some specifics that it looked like for me, often, most mornings at 9 a.m., 4 of us had planned Zooms. So it would be this morning scramble and trying to get everybody into their corner of the house. In the beginning, we had to scramble to get enough video cameras, audio, computers. And then, you know, my pre-K child just sort of running free, to be honest, and we're trying to keep her out of everyone's screens. And then towards the end, I would try and create a structure, but as a school counselor specifically, there was a lot of crisis response for me. And so that is what really sticks with me is my own child's stress levels. All three had really risen by this point in May, and so had the children that I'm serving. And you cannot plan crisis calls. So we would set a schedule for the day and then trying to manage that. That's really what sticks out to me with this pandemic, and just some of the things that we had to balance through it.
Thank you. Sarah, do you want to go next?
Absolutely. Good morning, everybody, and thanks for having me. It's a pleasure to be here. I'm Dr. Sarah Shank. I'm a primary care physician in Wilmington. I'm also the clinical director of primary care for Christiana. And one of my newer titles is medical director of our virtual COVID practice, which is a practice we developed back in March in response to the pandemic. In that practice, we take care of, I think we've taken care of over 4,000 patients to date, who either have COVID or are suspected to have COVID. And we take care of those patients virtually using video visits. And, you know, we're just talking about the silver lining in all of this. And at Christiana, we have had several silver linings, but one of them is being able to really develop and accelerate our virtual platform. It was really always part of our vision. And what probably would have taken us 2 to 3 years, we accomplished in 3 weeks back in March. So now all of our providers are up on video, able to care for our patients in their home. Professionally, you know, a lot of how I've been spending my time recently, other than taking care of COVID patients virtually, is helping our primary care practices reopen. So when we talk about schools reopening, we're having a lot of those same discussions about how do we really open up all of our ambulatory practices at Christiana so that our patients are safe and our staff are safe. We never closed down entirely because we're a hospital system, but we certainly sort of reduced access and closed some of our operating rooms and offices, and we're now in the process of reopening. Personally, I'm a mom to 4 boys, and they are, my youngest is 7, my twins are 11, and my oldest is 14. My husband is a critical care physician, so also taking care of COVID patients in the ICU, and he's an administrator as well. So we have been juggling working from our various clinical offices, hospital, and home. Like today, I'm at home. So it's been a struggle, just like it's been for all of you. But you know, I think a lot of the considerations that we meet when talking about reopening schools really applies to the ambulatory offices in the healthcare world too. So I think I'm going to learn a lot today on this call.
Thank you. Danae?
Hi, first I want to say please forgive the impromptu landscapers in the background making great noise as I'm on my Zoom. My name is Denise Suell. I am the director at Delaware State University's Early Childhood Lab School. And how do you do online learning for 5 and under? You know, is that even a thing? We have managed to make it an opportunity for parents to know that, you know, if you want your child to sit down and maybe see their teacher on the screen, we'll be doing it every day at this time, whether it's just a song or maybe a handwriting without tears for some of the older ones, letting the parents know that we're here to support them. Honestly, just trying to be as creative in the current, you know, scene that we're in right now. And what does that look like? That looks like, you know, giving a K-Prep graduation, even though we can't do it in the typical way. So we'll make yard signs and say, you know, lab school graduate lives here, and we'll give them boxes of sunshine with lemonade and different things in there. And their teachers will drive by their house and wave and tell them how much we miss them, while of course, keeping social distance practices in. It means letting the mothers know on Mother's Day, hey, there's other moms that are willing to talk with you, some adults that can talk, and we can have a tea and do a online, you know, Mother's Day tea, in light of the fact that we're not there to do the event in school, or drive around for Father's Day and drop off little homemade barbecue sauces that we've made. So our team has really had to think outside of the box of what this means for us. It's not like a 4th or 5th grader who might be able to sit in front of the computer for a period of time. but getting as creative as possible. Knowing that in a field where there is no normal, every day is different for us. Our main goals are to support the children, support the families, and myself as an administrator and my co-administrator, just support the teachers through this dynamic and what this looks like, knowing that every day is going to be different, and just keeping that at the forefront of our minds.
Thank you, Margie.
Okay. So on a personal level, I would say my two sons are grown. They're in their 20s now. So I didn't have to deal with it as a parent, but as a grandparent, because I was blessed with my first grandchild, who I'm trying to rock to sleep as I'm talking. So, we've learned how to multitask like crazy. On a professional level, it was a trying time that, we had to pivot and turn, and we have just shy of 1,000 students and just about 100 team members that we had to then sort of organize and go to this remote learning, which is something that none of us were prepared for. We were fortunate that we had invested in one-on-one technology early on. So our students had the devices, they just didn't have them with them because it wasn't part of our practice to allow them to take them home. So just organizing, getting the devices in their hands first. And, but that first week when the state of emergency went into effect, I think all of us took that week to just sort of pause and just sort of take inventory of where we were with our families. I think we were all sort of in a state of shock. And I think we needed to recognize that, and let everybody sort of settle in to what exactly was happening in the world around us. And then we were able to sort of shift into this remote learning. And pretty proud of how we did it. Not perfect. We definitely learned some things that we can do better going forward. But it is amazing how, people, educators, they have a passion for children, and we made it happen. So I'm grateful for that. But definitely, I think that families, parents, and guardians, I think, have a greater appreciation for what teachers do every single day. And that actually was something that was nice to hear, sort of the sentiments and the thank yous and the gratitude from people.
So, knowing that everything is changing, seems like day by day, and trying to acknowledge those unknowns while moving forward and trying to advise parents. Danae, maybe you can speak to some of the challenges, just logistically, the ratios, the workforce of an early childhood center. And I see we have a question in the chat about what's realistic in terms of screen time for young children. So maybe you can also address that.
Hey, Madeline, your voice is distorted.
I'm sorry.
Your voice is distorted. I'm not sure if there's...
Okay, I'll try to change my sound while Thanks.
Absolutely. So I'll start with the question in regards to screen time, and us wanting to adhere to, pediatric guidelines in regards to screen time. We are not expecting children, or would not expect them to sit there for 30 minutes and watch a screen. What we do know is realistic is that parents do have their child maybe watch CoComelon on YouTube, or we can't act like the screen doesn't exist. And, why not maximize on that opportunity for children in the ways that we can? And sometimes that just means that the teacher is on the Zoom and the child is walking by and they see their teacher. It's a quick 5-second, hi, Miss Ray, or hi, Mr. Kyle, or look at my, baby brother, or look at this thing that I found. Giving a little bit of consistency. The reality is wanting just to see their faces every day, having an opportunity to see their face, not necessarily, are you sitting down, legs crossed, watching me in your house and listening to my words? So it's really just an opportunity to see their teacher. And in this climate that we're in, there really is no major expectation, just providing that opportunity for them. In regards to some of the challenges and even just kind of what's being done, great support from the Office of Childhood Learning Department, Delaware Department of Education, in regards to providing us with resources and, we have the COVID childcare plan that's out. Yes, ratios now have been reduced in an effort to provide some sort of opportunity for social distance. And the reality is, how do you tell a 2-year-old not to go and hug their friend when they come into the classroom, or not to want to, you know, take that a mask and put it on their face? So being mindful of the things that we have that we may need to remove from the classroom, being mindful of what the ratio and the group sizes are now and how we can best meet the needs of the parents. So right now, our systems that we have in place, and especially in childcare, you know, hand washing is what we do. Just ensuring that those systems are more refined and the expectation and the quality is just a bit more higher. Having systems in place, what are we going to do to ensure that we have all of the materials that we need? I say this all the time, we can check, we can trust that we have to verify is where the main expectations are. And so it's about having those systems in place and understanding that the system that might work for one location may not necessarily work for another location. And how do you adapt? How do you say, okay, this may not work for us, but what can we do versus this just doesn't work? So even though like our day-to-day may not look the same as how it has looked, I feel like in the field of early childhood education, we step up to the plate, we show up, and we're just prepared because of our field in and of itself for whatever comes our way. And so the challenges we just view as obstacles to overcome, you know, just like you're on an obstacle course and, all right, this has just popped up. How are we going to get over to the other side of it and do it as a team and do it with a positive perspective?
Does this sound any better?
Yes.
Oh, good. Okay. Margie, I don't know what the state of your grandchild is, but do you want to kind of speak to the knowns, unknowns, you know, how you're thinking about the fall, what you learned from the spring?
Sure. I mean, the unknowns is that I think everybody's concern are the what ifs. I mean, we have so many what ifs that it sort of is the part that sort of increases the anxiety level, because we can put together a really great plan, but what if somebody gets infected? What if it's a child? What if it's a team member? It's a teacher? What if, you know, then how do we quarantine the whole school? Do we quarantine just a few classes? It's all of those what ifs that I think is giving all of us just a lot of anxiety, and it's hard to create a plan with all those what ifs, especially when, you know, we as state employees need we're looking for some guidance as well from the state agencies as well, since, you know, a lot of those things need to be sort of mandated or directives as opposed to local decisions. But I think that the bigger part is, you know, there are some people that obviously are at greater risk of the infection, and obviously a greater risk of, you know, of being affected just more so than you're hospitalized, more so than others. So we need to figure out, you know, exactly what the risk level is for every individual, and every individual is going to need to decide exactly what they're most comfortable with. And I think one thing that has helped to alleviate some of the anxiety is we went out to our parents, our families, and said, you know, we're giving you the choice. Like, if you already know, you know your child better than we do. If you know they're at greater risk because they're not going to wear their face mask during the day, or because they have an underlying medical condition, or because you have a grandparent living in the home that's suffering from cancer or some other, you know, other, you know, infection or other disease that could put them at risk, then tell us whether or not you're prepared to then support your child remotely 100%. And it was interesting, about a third of our families, a third of our students right now are prepared to just stay at home and learn remotely. So that was an interesting component. I think that was part of the survey that was done. You know, obviously it was in the spring, but we did a survey in July, now that we're looking at the reopening, and posed that question. So it was interesting to find out how many of our families have sort of come to the conclusion that that's the best option for them.
And I know your teachers were using an online platform and very creative tech-enabled learning previously, but maybe you can share about some of the creative things they've done and how that's been an asset during this process too.
Yeah, well, you know, I got to give credit to the Department of Education several years ago invested in a platform called Schoology. And I think most of us in the districts and the charter schools are using that to some extent. So our middle school students are very familiar with Schoology. So it was easy for them to transition. But our elementary grades, we weren't using Schoology as much. So definitely our, you know, like K-4 teachers had a little bit more of a learning curve than our middle school students. But that is the platform that we're going to continue to build on. I think the biggest thing that I think all of us realize is that because we didn't have any forewarning and we didn't have any advance notice and planning for the spring, we all went to, you know, what we could do best. And for the most part, it was, you know, it was videos and things like that and some live chats. But going forward, we really want to be able to do the live streaming and be able to actually do more distance learning. So a child sitting at home could actually be receiving instruction at the same time, real time, as the students that are sitting in the classroom in a hybrid model, and allow them to have some interaction with their teacher live. And it also takes some of the burden off the teacher, so they're not having to basically plan twice as much. You know, they're delivering one lesson at one time, and it's being delivered to 2 different groups of students in 2 different locations. So that's one of the things that we've learned, but we are grateful that we had at least the Schoology platform to build off of. And I definitely want to give a shout out to Zoom, because I don't know where we would have been without Zoom. And when they made their services available for free, I mean, kudos to them for really stepping up as an organization, because that really gave us at least a lifeline to connect with one another.
Thank you. Yeah, and I see we have a question about kind of tech access and online services. The state has been investing in towers in the western part of Sussex. I understand those will be up later this month. And we've actually gotten accolades from national partners saying that the Delaware districts and charters did such a good job asking who needed a device and deploying devices and Wi-Fi's and hotspots and all those things, that we were not as needy as some other states. So I think that's another way that the state and districts and charters have worked together to meet the needs of families. So Sarah, what about from a health and wellness perspective? What should parents know? And tell us about how people are being served safely.
Yeah, so, you know, I think it's important that we make sure all of us and our children are keeping up with our health maintenance. Vaccines are really important now. You know, there's a New York Times article recently that said probably children's vaccines are done anywhere from 40 to 70%, comparing this time to this time last year. And, you know, ChristinaCare is, we're definitely seeing well child visits. And I know a lot of our partners in the community are as well. We are taking a lot of measures to make sure that the offices are safe. We're cohorting sort of visit types so that at least at Christiana, what we're doing, and I know our community partners are often employing this strategy as well, is we're reserving the morning for well visits and the afternoon for sick visits. Some of our offices are large enough that we actually have 2 separate spaces in the office so that well visits can occur on one side with a separate entrance and exit from the sick visits that occur on the other side. And then finally, we're employing, as I mentioned earlier, telehealth. So a couple modalities there. One is video, which looks a lot like we're using right now. Another is telephone for people who don't have access to video or simply don't prefer it. And then finally, we're using a couple of secure communication platforms. One is called Twistle, where we can actually text with our patients and deliver a lot of care that way so that patients get care right from their home.
Thank you. And Madeline, do you want to play off of that and tell us a little bit about your role as a counselor, you know, in a remote world and some of the realities of that?
Sure, absolutely. And if you don't mind, I want to also just bounce to something Sarah said. It was interesting in May, my son had a surgery that had been pushed off. It was supposed to be in March, and I got a call on a Thursday, and they said, we're opening on Monday. We'd like your son to come in. So it was a really interesting conversation with my parents, who one is immunocompromised, and then also just within the family about this, how it would look, which we did go through with the surgery. And we felt very, very comfortable with everything that happened. But that was just an interesting piece of our experience as well during this pandemic. It was a surgery that really needed to happen. It got pushed back, and then we were one of the first to come back into it. So as a school counselor, what's been was a really big shift I found is I feel strongly Red Clay has, and I think every district I've worked with and charters that I know, they have a pretty good system built in place for what counseling and support looks like for schools and families when we're talking about crisis situations, when we're talking about kids that are struggling in the school system, what's our process? And what we quickly found is it was going to have to be switched a lot during the pandemic. And so one of the biggest things that I dealt with was, again, crisis. And when I use the word crisis in this setting, I'm talking about kids that have self-harm or suicidal thoughts. We didn't have access to the kid during that time, so leading up to it. So a lot of the cues that we would use to normally assess the mental health, of course we assess it right then, but we also know what their peer interactions are looking like. Usually there's a relationship with the teacher that we can go and say, have you seen changes? Are there grade changes? Are there peer changes? What's their physical health looking like? We didn't have any of those cues in which to support us. So assessing kids over the phone, or did we need to send support into the home? It was a big switch. And so that was a big piece of what we learned during the pandemic. And then something else I want to add to that I'm sure Margie could speak to, in the school that I serve specifically, but I know in a lot of schools in our state, there was a large portion of ESL or English language learners, or the parents were Spanish speaking. So the kid spoke English, but the parents didn't. And how do you serve a family like that? What processes are in place? And I think it's important on a state level that we speak about, for all the different languages that are in our state, what does that look like for those families? And what are some of the unique challenges that the parents face in getting support and access during the pandemic?
Yeah, you mentioned the added factor of crisis needing a translator, or the introductory materials to access the content that eventually the student needs. Those are just some of the things we've heard about.
Mm-hmm. Yeah, so I mean, vividly, one of my second situations was that no one in the home spoke English. And I'm not Spanish speaking, unfortunately. At school, we had a great system for that on how to support, but getting all of the different resources that we need to. Now, we did have translation services, so we were able to, but talking about what's the best way to make a call to a parent to have this conversation that we need to, it was an added layer of difficulty. So that's definitely in the state.
And Lindsay,
sorry.
Go ahead, Madeline.
No, that was it. I was just going to say that's a bit, I know that that's not unique to my district or my school. So I think it's something on a state level that definitely needs to be considered and addressed. And I think the schools are doing a good job too. Just that was one of the pieces of it.
Lindsay, if you want to respond to anyone's comments, and also I think it'd be helpful to hear about how you're meeting the needs of students with disabilities in this environment, and how do you address, social, emotional, and behavioral issues as well when you're in a virtual setting.
Absolutely. I didn't mention at the beginning that I'm also a member of Rodel on their social emotional learning team, and that's one of my huge passions in teaching is the social emotional well-being of students. It's what I've done for 12 years. I did see a question pop up. I was teaching elementary, and in basically a specialized classroom, self-contained type classroom. So in meeting the needs of that population, you have to be flexible in the classroom, so you also have to be flexible virtually. I offered several Zoom times, and we did that platform because if students did not have access to internet, there's a phone number that they could call in and join as well via phone. Fortunately, our district was wonderful in reaching out to families to get them devices and anything that they might need. All of my students have an IEP, so we mailed home any type of manipulatives or anything that they might need to access anything that I was going to teach. We taught curriculum and also made sure that IEP goals were covered. With the social emotional learning piece, in the weekly plan, they did math and reading daily, and they had science, and there was a social emotional learning piece that was also included on the daily plan. On the team that I worked on, because we worked together as a team to teach, there was a paraprofessional who specializes in behavior and a counselor. So we all worked together. There was also another teacher to develop these plans. And when we Zoomed, we all Zoomed together. So I would basically do the academic piece, and the counselor and the behavior para would be on there too to do the SEL piece. Or we would, bounce back and forth because of the relationships with the kids. There was a student that I teach who was not able to be with the other students on Zoom because it frustrated him. So we had to set up a different time during the week specifically just for him. We didn't meet with students virtually by ourselves, so another staff would be on there. But we made sure as best as we could that students had what they needed with manipulatives. If there was a student who had difficulty accessing internet to be able to access whatever I made through Google Slides, then I had to make sure that I had something available to send, and it was mailed to the family. So they had in-hand packets if they didn't have access to that. They had the capability of taking a picture and emailing it back to me, or just a phone call. So I could call on the phone and we could work through the work that way if chosen. The flexibility that teachers offer in the classroom absolutely had to be carried over virtually. And as far as I know, they did a great job. This was a huge learning curve for some teachers. I don't love technology, and there were many nights I had to sit up and figure out how to use certain things before I could expect my students to access and figure it out.
Yeah, thank you. And a lot of what you talked about was about the relationship you have with your students. A lot of what we heard from families, and I know several of you have rising kindergartners, and Margie's about to start at 9th grade, with students and children who don't have relationships with the new teacher or the new school that they're going to be starting in the fall. How are you thinking about that? And how can we build relationships? Danae, you talked about some creative ways to socially distance and kind of see teachers, but how are you thinking about, starting a new school year and building those relationships?
I think honestly, what our main focus is on for my team, myself, is really having a why not attitude versus a yeah, but, right? There are so many things that we could say as to why we couldn't do something. The reality is this is not what we're used to. That's just it. And so if we stay stuck there, we can't then focus on how we can show children that, we can overcome, we can evolve, that we can grow, that we can try to problem solve a situation that may seem like, it cannot be problem solved. We're not going to knock on parents' doors and barge in and say, I'm going to hug your child today because I haven't hugged a child in forever. But, it's similar to just taking a problem and seeing, okay, well, how can, in the movie Apollo 13, how are you going to fit that circular piece of equipment into a square peg? It just has to be done. And we have to just try to find ways. And like I've shared before, the ways that my team and I come up with may not be the ways that would work for your team, but we just keep plugging and keep trying to see what will work. Not for every family may not have that technology, but maybe a phone call, right? Maybe getting the team together. It's literally not just been something that I've only myself have had to do. My team has stepped up and, okay, well, you're going to take these 5 families and drive to their house and put up a sign that says, we miss you. And, we're thinking of you as we drop off, something for them. It's just about getting creative. Lindsay talked about flexibility, and in the state that we're in, we need Slinky-like flexibility, be able to just flip whichever way that needs to be flipped, looking at what's of course, in the best interest of the child, but the families and the teachers themselves.
Thank you. Margie, maybe some last words in terms of advice for either policymakers, parents, and then I'll ask Diane to share a little bit about what the readiness teams are thinking about and doing moving forward to support parents.
Wow. So I would say one of the things that I think Madeline had mentioned is about our English learners. So definitely want to hit on that point that I think one thing that we've all learned is that the translation of communication needs to be an intentional part of the process, not an afterthought. And I'm always baffled in a lot of discussions that I'm in, and this is not just at the local level, but the state level and county level, where a communication is put together so nicely, and then it's sort of an afterthought, sort of scrambling to figure out how we're going to translate it. It has to be an intentional part of the process. No communication should ever go out if it's not available in English and in Spanish. So you've got to create the infrastructure to make sure that that can happen. But then the other thing is that we have to realize that people's literacy levels vary. So even with the translation of the material, it may still not connect with your audience. So you also need to have outreach so that people can actually speak to somebody and have sort of a dialogue as opposed to getting everything in print. And, I have to share, one of the ideas that I got from being involved in a national funder and being part of their portfolio. I get to interact and meet different charters in different states. And, one particular charter down in Atlanta and another one in Minneapolis. I mean, if we think that our EL population is large and a challenge, to hear their stories, it's like nothing, it doesn't compare to what they deal with. But one of the things that they do that I thought was really, really nice is that they create a community effort. So they have that are part of their network. So the languages, whether it's Haitian, whether it's Arabic, these other languages that may be more difficult to find translations for, they actually recruit family members to be sort of the spokesperson in that language, and they reach out to those families and make connections. So I think learning from these other states that really have far more diversity than we do is something that we can learn from. But it just has to be intentional. It just can't be an afterthought. And I think that especially in the remote environment, it's something that you sort of have to recruit across the board. Is not just that one Spanish teacher. She's not the one that can do all these translations and interpretations. You really have to have a system and have resources in place to help you. So that's one thing I would definitely encourage that's not lost in this. The other thing I want to be sure that before we end is, because I mentioned this in another venue as well, is one of the things that we're looking at, obviously, 90% of our time is spent on talking about the reopening of our schools. We can't forget that we're facing two pandemics here, not just COVID-19, but it is racism as well. Even though the protest and the unrest may have sort of eased down, it's not really forefront on the news. It is something that our students are still thinking about and are still dealing with. And it's something that we need to deal with as a community, as a society. Let's just not focus on COVID. There's two pandemics here that we need to address.
So thank you, Margie, and I completely agree with that. And with that said, we are, as readiness teams, trying to take this information from the survey results and provide programs and resources to families to help best meet needs. Some of the things that we've tried to do is to adapt to a virtual learning session. And in some cases, you're right, they don't have the materials at home. So how do we do that? And so we've really looked into getting some things that are maybe household. Let's go on a scavenger hunt and find things before we do some of these activities. So we've heard from families, and they've expressed a lot of interest in educational resources and kindergarten registration information and developmental screening resources. And there is really a lot of great resources out there to support children. And these resources can really be broken down by age or ability or developmental milestones. And we've tried to take these resources and make them available to families. And just so they have them. I mean, as a parent, I don't know what I don't know. And just providing some different activities and enrichment opportunities for children at home has been helpful. We've had families continue to share how, one online kindergarten registration process would benefit them, especially during these challenging times. And, so I recommend people advocating for changes that are going to make things easier for families. And then also we have tools that are available that are free online developmental screening tools using ages and stages. It's available for children birth to age 5. And so during this time, families should take advantage of these opportunities to really help support their child. And, with that said, we're looking at kind of like 3 main buckets that we've learned from the survey, with mental health and resources and health and safety. And we're looking into these areas to try to get additional information for families. We recognize that we don't have the answers, and we're looking for partners out there that do have some of those answers. But as a parent, I kind of learn something new every day of some of the things and some of the recommendations and helpful hints. And it's just some of those things, when you hear those as a parent, are helpful. And so we're trying to get that information and push that out. So there's more to come on that.
And a lot of what we had hoped to hear was about some of the childcare issues. I know we are going to wrap here, but we're going to have Diane and some other providers talking about the issues in childcare next week at our Early Childhood Council meeting. So I'll put the link to that in the chat and we can dig in a bit more. This last slide really is about, we plan to come back with parent resources on these topics, as Diane mentioned, but we also want to hear from you. So feel free to email us, put in the chat, or fill out the survey at the end to tell us how we can come back and share resources with parents and continue to stay in touch and support. Paul? Oh, you're on mute.
So sorry, one last question that sort of surfaced. Jack Perry, I think, raised it, but it was in response, I think, to an earlier comment about isolation being a potential problem. And the question was around something that was in the New York Times about parents creating learning pods or kind of sort of informal connections amongst peers. And I wanted to ask Sarah real quick. I know this, just from a health perspective, this is happening organically. I see that in neighborhoods already. Parents are just saying, hey, we need to socialize and we're going to just take the risk. But wanted to get a sense from a health professional about sort of how to potentially do that or just not to do it at all.
No, I mean, I think there is value in that. We are doing that in our offices and in the hospital where we have teams only working with each other. So we may have a week with one team on site, one team off site, and then they switch. And we have had some community exposures, meaning some of our caregivers have contracted the virus, thereby putting their colleagues at risk. And so if that happens, we take that whole cohort out of the rotation and they all work from home. I do think that there's value in that. And if we're talking about reopening schools with a hybrid model where some kids are off-site and some kids are on-site, it probably makes sense to do that in cohorts. So that if there is an exposure within one cohort, the other cohorts are protected.
Thank you. I know there's other comments that were in the chat, but that one I know is a lead story in the New York Times today. So we're going to send a survey post this webinar, and obviously there's going to be ongoing conversation. I think it was Danae said early on that she likes to be part of a village, in terms of being connected to folks. And when I talk to folks nationally, I do really talk about how people in Delaware are connected in ways that is different than many other states. And some politicians have talked about us being a state of neighbors. I hope you look at this as part of a connection. The folks that you've connected with here are going to be ongoing resources, and Rodel wants to be a resource, so continue to check our website and engage with us. Let us know what you're thinking. So thank you very much. I think we're at time, and hope you have a great start to the year. It's going to be a challenging one, but I think to Danae's comment earlier, we'll figure it out. So thanks again, and we'll talk to you soon.